Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Have you ever wondered how and when to use amitriptyline? Perfect, because today I'm going to explain everything about this antidepressant. Amitriptyline is a medicine primarily used to treat depression. However, it also helps with nerve pain, migraines, and some anxiety problems. It's a super useful tool for doctors. And how does it work? Well, amitriptyline increases the levels of certain chemicals in the brain, like serotonin and norepinephrine. This improves your mood and relieves pain. Let's talk about how to take it. It's very important to follow your doctor's instructions. Normally, you start with a low dose, like 25 milligrams a day. Then, the dose is gradually increased until you reach the amount that works best for you, which is usually between 75 and 150 milligrams a day. It's best to take it before bed because it can make you sleepy. Now let's talk about the side effects and what you should keep in mind. Amitriptyline can cause dry mouth, blurry vision, constipation, and drowsiness. In very rare cases, it can have more serious effects, such as altering your heart rhythm. If you notice anything unusual, tell your doctor. And finally, some important advice. Never change the dose on your own, and don't suddenly stop taking it without talking to your doctor. If used correctly, amitriptyline can help you a lot. I hope this video has helped you. Subscribe to the channel for more information about your health. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.